Welcome to the most comprehensive guide to understanding and treating alcoholism available anywhere. Whether you're personally struggling with alcohol, supporting a loved one, or you're a healthcare professional, this video contains life-saving information based on the latest medical research and breakthrough treatments. I'm going to cover everything, from recognizing the earliest warning signs to understanding when alcoholism becomes a medical emergency, from breakthrough medications that didn't exist 5 years ago, to holistic approaches that support long-term recovery. Most importantly, I'll give you specific, actionable steps you can take today. Let's start with the reality of alcoholism in 2025. 28.9 million Americans aged 12 and older have alcohol use disorder. That's 10.2% of this age group. But here's what makes this truly sobering. 385 Americans die daily from excessive alcohol use. That's more than one person every 4 minutes. The economic impact is staggering. $249 billion annually, which breaks down to $2,490 taken from every American household through healthcare costs, lost productivity, and criminal justice expenses. But here's the statistic that should give you hope. 75% of people who receive proper treatment are successful in their recovery. 22.3 million Americans are living proof that recovery works. Alcoholism is a chronic medical condition that fundamentally changes brain chemistry. It affects 3 key neurotransmitter systems: dopamine for reward and pleasure, GABA for relaxation and anxiety reduction, and glutamate for excitation and energy. With chronic alcohol use, your brain adapts by reducing natural dopamine production and increasing glutamate activity. This creates the physical dependence. You need alcohol just to feel normal, and stopping creates dangerous brain hyperexcitability that can cause seizures and even death. This isn't a character flaw or lack of willpower. It's a medical condition that requires medical treatment, just like diabetes or heart disease. Recognition is the first step to recovery. Let me give you a comprehensive checklist of warning signs. Physical signs include increased tolerance, meaning you need more alcohol to feel effects. Hand tremors, especially in the morning, are a classic sign. Bloodshot or red eyes consistently, unexplained injuries or bruises from accidents while drinking, changes in sleep patterns like insomnia or excessive sleeping, frequent headaches or hangovers, poor personal hygiene or appearance, and significant weight loss or gain. Behavioral changes involve drinking alone or hiding alcohol consumption, making excuses to drink like to relax or to cope with stress, prioritizing drinking over work, family, or social responsibilities, continuing to drink despite negative consequences, failed attempts to cut back or stop drinking, drinking at inappropriate times like morning or at work, risky behavior while intoxicated like driving, and financial problems related to alcohol purchases. Psychological signs encompass extreme mood swings and irritability, depression or anxiety, especially between drinking episodes, defensiveness when questioned about drinking habits, denial or minimizing the extent of alcohol consumption, social isolation from family and friends, and loss of interest in activities once enjoyed. For families, pay special attention to secretive behavior, defensive responses when alcohol is mentioned, and the inability to stop drinking even when they want to. This information could save a life. There are specific situations with alcoholism that require immediate 911 response. Alcohol poisoning signs include mental confusion or stupor, vomiting, especially if the person is unconscious, slow breathing with fewer than 8 breaths per minute, irregular breathing with 10 or more seconds between breaths, unconsciousness, or inability to wake up, seizures of any kind, and clammy, cold, or bluish skin, especially lips and fingernails. Alcohol withdrawal emergencies involve delirium tremens, which typically occurs 96 hours after the last drink, and includes profound confusion and agitation, visual, auditory, or tactile hallucinations, high fever over 101 degrees Fahrenheit, severe tremors throughout the body, rapid heart rate and high blood pressure, and profuse sweating. This condition has a 35% death rate without immediate medical treatment and a 15% death rate even with treatment. What to do in emergencies? Call 911 immediately. While waiting for help, position an unconscious person on their side to prevent choking, monitor breathing and pulse, keep them warm, and never leave them alone. Do not give coffee, cold showers, or try to walk it off. This is where the science gets exciting. We have 3 FDA-approved medications, but new breakthroughs are changing everything. Naltrexone works by blocking opioid receptors in the brain that create the pleasurable effects of alcohol. It's available as a daily pill or monthly injection called Vivitrol. Studies show a 41% abstinence rate at 1 year compared to 17% with placebo. It's particularly effective for people who drink for positive reinforcement, the reward drinkers. Acamprosate modulates the brain's glutamate and GABA systems to reduce the hyperexcitability that occurs during withdrawal and early recovery. It's better for maintaining abstinence than reducing heavy drinking, with a number needed to treat of 12 for preventing return to drinking. It works best for relief drinkers who use alcohol to manage negative emotions. Disulfiram creates unpleasant reactions when alcohol is consumed by blocking an enzyme that processes alcohol. It's only effective under direct supervision, but can be powerful for motivated individuals. The most significant breakthrough in alcoholism treatment in decades involves GLP-1 receptor agonists. Medications like semaglutide, known as Ozempic or Wegovy, originally developed for diabetes and weight loss, are showing remarkable results for alcohol addiction. A 2024 Phase 2 clinical trial showed significant reduction in alcohol consumption and cravings compared to placebo. Population studies reveal 56% decreased odds of developing or relapsing into alcoholism among people taking these medications. The mechanism involves GLP-1 pathways that overlap with dopamine reward systems involved in alcohol addiction. This represents a completely new approach to treating addiction. Understanding the recovery timeline helps set realistic expectations. Days 1 through 3 involve acute withdrawal, where peak symptoms occur 72 hours after last drink. Physical symptoms include tremors, sweating, nausea, and anxiety. This is the highest risk period for seizures and delirium tremens, making medical supervision often necessary. Days 4 through 14 bring stabilization as acute withdrawal symptoms subside. Sleep and appetite gradually normalize. Mood swings are common, and medications like naltrexone are typically started. Weeks 2 through 12 represent early recovery where post-acute withdrawal syndrome may persist. This includes sleep problems, mood instability, and anxiety. Cravings can be intense but decrease over time, making therapy and support groups crucial. Months 3 through 12 constitute long-term recovery as brain chemistry continues normalizing. 1/3 of patients show no AUD symptoms by 12 months. Relapse risk decreases significantly after 90 days of treatment, and focus shifts to lifestyle changes and relapse prevention. The future of addiction treatment is personalized medicine. Research is identifying genetic markers that predict treatment response. The OPRM1 gene variant affects naltrexone response. The IL-17RB gene influences acamprosate effectiveness. HTR3A and HTR3B polymorphisms predict ondansetron response. Mayo Clinic researchers have identified 12 proteins that may predict acamprosate treatment success, moving us toward precision prescribing. Even without genetic testing, we can use phenotype-based selection where reward drinkers who drink for positive reinforcement respond better to naltrexone, while relief drinkers who use alcohol to cope with negative emotions respond better to acamprosate. Families play a crucial role in recovery, but the approach matters enormously. Effective communication techniques include using I statements like, "I'm worried about you," rather than, "You have a problem." Be specific by giving concrete examples of concerning behaviors. Show empathy with statements like, "I know this is difficult." Listen actively and allow them to express feelings. Focus on love and concern, not judgment. Professional interventions have higher success rates because they're structured, mediated by trained specialists, and immediately connected to treatment options. Family-led interventions should involve 3 to 5 close people, occur during sober moments, include planned consequences, and have treatment options ready. Research shows Al-Anon participation improves family quality of life and reduces conflict regardless of whether the alcoholic seeks treatment. The program helps families understand they didn't cause the addiction, can't cure it, and can't control it, but they can take care of themselves. Recovery involves more than just stopping drinking. The most effective approaches address mind, body, and spirit simultaneously. Alcohol depletes critical nutrients, particularly B vitamins, magnesium, and zinc. Thiamine or B1 deficiency can cause permanent brain damage. Supplementation protocols should include B-complex vitamins for nervous system health, NAD plus therapy for craving reduction and cellular repair, omega-3 fatty acids for brain health and inflammation reduction, and probiotics for microbiome restoration. Emerging research shows alcohol significantly alters gut microbiome composition, creating dysbiosis that affects mood, cravings, and behavior. Fecal transplant studies demonstrate that gut bacteria from alcoholic patients can transfer addictive behaviors to mice. Restoring gut health through probiotics, prebiotics, and anti-inflammatory nutrition supports recovery by reducing neuroinflammation and improving neurotransmitter production. Exercise stimulates the same dopamine and serotonin pathways as alcohol, but without addiction risk. Studies show people engaging in regular aerobic exercise are significantly less likely to use substances. Group exercise programs have higher adherence rates and provide social support. Mindfulness-based relapse prevention shows superior results compared to standard treatment. Stress reduction is crucial because it eliminates triggers that lead to relapse. Evidence-based techniques include meditation, deep breathing exercises, and the 5-4-3-2-1 grounding technique for acute stress. Digital health interventions are revolutionizing addiction treatment. The A-Chess smartphone app system demonstrated 1.37 fewer risky drinking days compared to control groups by providing GPS-based warnings for high-risk locations, panic buttons for immediate support access, progress tracking, and milestone recognition, connection to peer support networks, and cognitive behavioral therapy modules. While 12-step programs help many people, evidence-based alternatives exist. Smart Recovery uses cognitive behavioral therapy and rational emotive behavior therapy with a 4-point program focusing on motivation, coping with urges, managing thoughts and behaviors, and living a balanced life. LifeRing's Secular Recovery emphasizes strengthening the sober self while weakening the addicted self through peer-led, individual-focused support. Women for Sobriety addresses unique needs of women through 13 acceptance statements, focusing on self-worth and empowerment. Research shows these approaches have comparable effectiveness to traditional 12-step programs, allowing people to choose what resonates with their beliefs and preferences. Relapse rates of 40–60% are similar to other chronic diseases like diabetes or hypertension. Understanding this helps reduce shame and encourages multiple treatment attempts. The 3-stage relapse model includes an emotional stage where negative emotions set up relapse risk, a mental stage where thoughts about drinking begin, and a physical stage where return to drinking occurs. Evidence-based prevention strategies involve HALT assessment to monitor for hungry, angry, lonely, tired states, trigger identification and coping skill development, support network activation at multiple levels, lifestyle balance integration, and mindfulness-based relapse prevention protocols. Women face unique challenges as they achieve higher blood alcohol levels with the same amount of alcohol, experience faster progression to liver disease, have greater cardiovascular risks, and face different social stigmas around drinking. Elderly individuals require special consideration due to slower alcohol metabolism, higher medication interaction risks, greater fall and injury risks, and more severe withdrawal complications. For pregnant women, any alcohol use during pregnancy risks fetal alcohol syndrome. Emergency evaluation is needed for any alcohol-related symptoms during pregnancy. Treatment costs vary significantly. Generic naltrexone costs $50 to $100 monthly, acamprosate $200 to $300 monthly, Vivitrol injection $1,500 to $2,000 monthly, comprehensive outpatient treatment $3,000 to $10,000, and residential treatment $10,000 to $30,000. However, the cost of untreated alcoholism averages $249 billion annually in the United States. Early intervention is dramatically more cost-effective than treating late-stage complications. Recovery is not just possible, it's probable with proper treatment and support. The statistics are encouraging. 75% of people completing treatment programs report success, 68% of people completing detox programs maintain sobriety, 22.3 million Americans are living in recovery right now, and multiple treatment attempts often lead to success even after initial relapses. Future directions in treatment include expanded GLP-1 medication research, precision medicine based on genetic testing, microbiome-based therapies including fecal transplants, advanced brain stimulation techniques, and improved digital therapeutics with AI support. Alcoholism is a serious medical condition, but it's also a treatable medical condition. The combination of breakthrough medications, evidence-based therapies, family support, and holistic approaches offers more hope than ever before. If you're struggling with alcohol, know that treatment works and recovery is possible. If you're supporting someone else, your role is crucial. But remember that you can't control their recovery, only support it. Immediate next steps include, if you're in immediate danger, call 911. For treatment information, call SAMHSA at 1-800-662-4357. Consider starting with your primary care doctor. Look into Al-Anon if you're a family member. Research treatment options in your area. Resources mentioned in this video include SAMHSA National Helpline at 1-800-662-4357, crisis text line by texting HOME to 741741, 988, suicide and crisis lifeline by calling or texting 988. Al-Anon family groups at al-anon.org, and Smart Recovery at smartrecovery.org. Recovery happens one day at a time, but it starts with one decision. That decision could be today. You are not alone. Help is available. Recovery is possible. Subscribe now to join thousands getting reliable health information that improves lives, as knowledge is your best medicine, and we hope you've gained valuable insights from this video series. Make sure to subscribe and like this video. It helps us create even more valuable health tips for you and others. Don't forget to share with anyone who would find this useful. Also, please comment below with any questions or topics you'd like us to cover next. Stay informed, stay healthy,